We live in an age where a smartwatch catches a heart attack before it happens, and algorithms spot cancer almost instantly. But this medical utopia has a strict boundary line. Access to these life-saving tools often depends entirely on your zip code. While highly developed areas deploy sophisticated digital networks, resource-limited hospitals are restricted by crumbling infrastructure and severely tight budgets. All the technological brilliance in the world holds little value if the innovations cannot actually reach the populations that need them most. A recent piece of literature aims to solve this exact disparity. The paper is titled Technological Advancement in Smart Healthcare Management System. Published in the British Journal of Advanced Research, lead author Adikwu Livingword and his team examine how to deploy high-end tech in places lacking basic resources, attempting to close the gap between theoretical medical power and ground-level reality. This study investigates the intersection of specific digital tools and the logistical challenges that define modern global health. To understand the proposed solution, we have to look at the three technologies driving modern healthcare delivery. First is the Internet of Things, or IoT. Think of it as a web of connected devices continuously transmitting health data from patients directly to a hospital hub. By automating collection and remote monitoring, this network slashes response times and removes manual data entry bottlenecks. Next is artificial intelligence. This acts as the analytical engine, taking that massive stream of patient data and making sense of it. Machine learning algorithms can predict health risks and tailor personalized treatment plans faster and more accurately than traditional diagnostic methods. Finally, there is blockchain. This technology acts as an impenetrable digital vault. It encrypts sensitive health data across a decentralized network and creates traceable records to fix broken pharmaceutical supply chains. When integrated, this triad creates a proactive ecosystem that upgrades how medical care is managed and delivered. But deploying this ecosystem in the real world reveals serious roadblocks. In many developing regions, the basic digital infrastructure simply isn't there. You cannot run continuous IoT monitoring devices on power grids that experience frequent blackouts, or over internet connections that barely function. Then there's the cost. Acquiring hardware, licensing AI software, and maintaining secure networks requires massive capital that underfunded public health systems do not have. This chart illustrates the third major hurdle, the skill gap. It shows the stark deficit between the high technical expertise required to maintain these interconnected systems and the actual number of trained IT specialists and healthcare workers available on the ground. Researchers force the industry to stop asking whether the technology works in a lab and start asking how we deploy it in hostile, under-resourced environments. To bridge this gap, the study provides a specific framework for local and international implementation. It starts with targeted investments in the basic foundation. Before building a blockchain network, governments and international organizations must first secure reliable electricity and internet access for rural clinics. To handle the massive upfront costs, the paper advocates for public-private partnerships, sharing the financial burden among governments, tech providers, and local institutions. Next, massive capacity building is required. Healthcare professionals need specialized training programs to actually operate and troubleshoot these advanced systems day to day. Finally, administrators must establish clear regulatory frameworks to ensure data privacy, interoperability, and ethical standards are maintained safely. Modern healthcare requires a strategy as sophisticated as the technology it utilizes. By prioritizing infrastructure and training alongside the hardware, Adikwu Livingword and the research team demonstrate how smart systems can finally be deployed where they are needed most.
Submit your manuscript today.